Hello everyone, I am Prince Allen M. Calaguio from BSBA. So this is my report on science, technology, and society. So the topic that I will discuss is about gene therapy. Gene therapy is a medical approach that treats or prevents the disease by correcting the underlying genetic problem. Gene therapy techniques allows the doctor to treat a disorder by altering a person's genetic makeup instead of using drugs or surgery. So, ang gene therapy ay gawa ng mga eksperto na nagbibigay ng lunas at nagpapagaling sa mga malulubhang sakit dulot ng mga gene mutation. Two types of gene therapy: somatic cells gene therapy and germline therapy. Somatic cells gene therapy involves obtaining blood cells from a person with a genetic disease and then introducing a normal gene into the defective cell. This type of gene therapy does not prevent the disease from occurring in the next generation because it does not affect the sperm and egg cells. Somatic cells gene therapy only affect the other body cells. Somatic cells gene therapy has to be done several times over the course of the patient's life because the effects do not last very long. The contrast of somatic cells gene therapy is germline therapy. Germline therapy takes place in the reproductive cells. It involves the genetic modification of germ cells that will pass the change onto the next generation. This type of gene therapy only has to be done one time to be permanent. One type of germline therapy is to treat a pre-embryo that carries a serious genetic defect before it is placed back in the mother by in vitro fertilization. Another germline therapy is to treat adult sperm and egg cells to the genetic defect is not passed into the children. Ang somatic cells gene therapy ay piniperform sa mga cell na hindi nagproproduce ng sperms or egg cell. At ang germline therapy has effects to develop a fetus that has long-term side effects na hindi pa napag-aaralan. Stem cells can be defined operationally as cells that can continuously self-renew and have the potential to generate intermediate and mature cells. Ang mga stem cells ay mga uri ng cells na nagre-repair at nag-generate sa mga nasisirang tissue. Kaya ang mga stem cells ay ginagamit sa gene therapy. Sources of stem cells. Stem cells originate from two main sources: adult body tissues and embryos. Scientists are also working on ways to develop stem cells from other cells using genetic reprogramming techniques. Adult stem cells, also called tissue-specific or somatic stem cells. Adult stem cells exist throughout the body from the time an embryo develops. Stem cells can turn into any type of cell before they become differentiated. A person's body contains stem cells throughout their life. The body can use these stem cells whenever it needs them. Embryo or embryonic stem cells are from the very early stage of pregnancy. After the sperm fertilizes the egg, an embryo forms. Around 3 to 5 days after a sperm fertilizes an egg, the embryo takes the form of blattocys or ball of cells. The blattocys contains stem cells and will later implant in the womb. Embryonic stem cells come from blattocys that is 4 to 5 days old. When scientists take stem cells from embryos, these are usually extra embryos that result from in vitro fertilization. In 1990, 4-year-old Ashanti De Silva became the first to success gene therapy. She was born with a severe combined immune deficiency. Due to lack of the enzyme adenosine, her T cells died off, leaving her unable to fight infections. Injection of a synthetic enzyme helped, but only temporary. Gene therapy application to patients are very helpful. Dahil natutulungan nito yung mga pasyente na may mga malulubhang sakit tulad ng cancer at iba pa. Gene therapy has been associated with several problems over the last few decades. One of the main issues is lack of knowledge about the long-term effects of the therapy, and the field is fraught with ethical concern. Gene therapies, or the scientists, hold promise to treat many diseases, but they are still new approaches to treatment and may have risks. Potential risks could include certain types of cancer, allergic reaction, or damage to organs or tissue if an injection is involved. Recent advances have made genetic therapies much safer. So, ang mga gene therapies ay patuloy na nag-aaral dahil hindi rin tumitigil kumalat ang mga sakit.